So dear friends, before starting the class, first I would like to tell you 3 points. They are really very wonderful. These 3 points are called leg rapid horses. Leg rapid horses. Like we have seen finger rapid horses. When we talk about the horse, the meaning of horse, who is running all the time without tiredness. The meaning of horse means chi, having great chi. So when we are putting the points, either the finger rapid horses or the leg rapid horses, they are improving the lung chi. They are improving the lung, asthma, pneumonia, skin problems. So because today, while doing the other discussion and we are in the need of these points, so let's start with this point first. And even someone asked me yesterday, can you tell me the points for psoriasis, for skin disease? So the points I am going to tell you, really amazing point for skin disease, for psoriasis, any type of the skin infections, whether the external skin or the internal skin, whether the skin who is visible here or the internal skin of the ear. Suppose there is a pus discharge from the ear, we are telling otitis media. Pus is coming from the ear. We have to treat the skin. Psoriasis, very complicated disease, psoriasis. We can get wonderful results by the leg rapid horses. And eczema, fungal infections, dandruff. Any type of skin problem, we will treat the rapid horses. If you remember, we have discussed the finger rapid horses in the index finger, 3 points, 11.07. 1 point in the center, 1 point up, 1 point down. Remember? Finger rapid horses in the index finger, in the middle phalanges, on the back side, 11.07, very good point. Now, when we talk about the leg, there are 3 points. So now we will be having finger rapid horses as well as the leg rapid horses. So how I will tell you, the finger rapid horse is good for skin. The leg rapid horse is also good for skin. So how to decide whether to use finger rapid horses or the leg rapid horses? Because finger rapid horse is good for skin. Even the leg rapid horse is good for skin. Both are good for skin and both are good for lungs. The finger rapid horses or the 11.07 point here. Finger rapid horses or the 11.07 here, they are good for skin. So I told you it's a very good skin for the female having black dark spots over the face. It's very good for improving the beauty in the female. Then how to decide? What do you think? When to put finger rapid horses, when to put leg rapid horses, because both are the leg rapid horses and both are working for the skin. So the difference is this: if there is an acute problem, we can use upper. Upper is young. If there is a chronic problem, deeper problem, the problems in the long time, we can use leg points. Got it? Wonderful. Even many person have given the right answer. They know this. Wonderful. So how to decide? Let's see the location first. I will show you the image. So look at it. So look at it. If I am standing like this, I'm standing like this. So where my middle finger is touching, that is the location of gallbladder 31. This is the gallbladder 31. If I'm standing like this, so where my index finger is touching, middle finger is touching, that is the location of gallbladder 31. The gallbladder 31 is the point 7 chun up away from the knee. 7 chun. Even I can measure. It's a 7 chun apart, 7 chun proximal. 3 chun, 3 chun, and one more chun, then I will be reaching on the gallbladder 31. 3 chun, 3 chun, and one more chun. So the 7 chun up, that is the location of gallbladder 31. If from the gallbladder 31, if I am coming 3 chun anterior, I will be reaching on the stomach meridian. So this is the stomach meridian. Stomach meridian is here. So gallbladder here, stomach is here, and the distance between gallbladder to stomach is 3 chun. 3 chun. So the gallbladder meridian just on the side. From this point, if I am coming 3 chun anterior, that is the location of stomach meridian, and that is the middle point at the location of gallbladder 31. That is the middle point, or from the corner of knee, if I am coming 7 chun up, that is my middle point. That is the middle, right? So I can tell from the corner of knee on the stomach meridian, if I am coming 7 chun up, that will be the location of middle horse. Or from the side, if I am coming 3 chun anterior, that is the location of middle horse. So look at here. If I draw the stomach meridian, so this is the stomach meridian. You can see this is the stomach meridian, right? Stomach meridian. So this is the point which is called middle point, middle one. So my first needle will be going on this point. I can insert the one needle here. This is the needle I am inserting here. I can insert the 1 chun needle here, or I can insert the 2 chun needle here. I can insert only 1 chun, 1.5 chun, or 2 chun needle here. So this is the point called middle horse. Now from here, if I insert the 2 needle, 2 chun down and 2 chun up, so the combination of 3 needles are called leg rapid horses. So now I am inserting, so first the center point, then I'm inserting 1 needle up, 2 chun up, upper horse, then another needle 2 chun down, lower horse. Now 3 points together are called leg rapid horses. The excellent point combination for skin disease. We can put the point bilateral without any problem. We can put on the both sides. With the help of these, we can treat each and every problem of the skin. Now question comes, why these points good for skin? Why? So the answer is this. As per the imagination, if you do the imagination, and if you do the imagination of whole body in the legs, the leg is whole body. Then the buttock area is head. This is the chest, right chest. This is the navel, lower abdomen, and these are the genital. Legs, the feet are the genitals. So we can do the whole body imagination in the legs. So here we are having chest. In the chest, when we are going in the stomach meridian, we are directly treating the lungs. So these points are very good for lungs. That's why they are very good for skin. So with the help of these points, we can treat the legs, we can treat the skin, we can treat the pus formation, we can treat pus discharge from the ear, pus coming from anywhere, eczema, psoriasis, all the type of skin diseases, and many other conditions, right? We can put the point bilateral. Just you have to make sure that you are on the stomach meridian. Now the question comes to sometime it becomes very difficult. How to look at the stomach meridian properly? Sometimes we might get confused that how to locate the stomach meridian properly, right? So I will show you here. So fine, let's see this. Because we need to locate stomach meridian very properly. Without locating the stomach meridian, it will be very difficult. Otherwise, you might go here and there, right? So look at this image now. If we look at in this image, we can find one protrusion here. We are finding one protrusion. This protrusion is the protrusion of the hip bone in the upper part. The hip bone in the upper part, right? So from this protrusion, we have to keep on moving downward. So I will tell you how to do that. Look at here. So look at here. If I'm standing like this, then I know this is the bone of the leg. And I can feel the bony protrusion here. You can feel the bony protrusion downward here. Right. Can you feel the bony protrusion here? Anyone? Can you feel the bony protrusion here? Anyone? Okay. The another way to find out the exact location, because it might create confusion. Another easy way. Standing like this on the side, then from the middle finger, you have to come 3 chun front. From here, come 3 chun front. Then this is the stomach. Okay. Exactly from the side, if you are coming 3 chun front, that is the stomach. Is it the easy? The first one is easy or second one is easy? Second one is easy. Ultimately, we have to locate the right stomach meridian and put the 4 needle randomly. The first needle will be 7 chun up at the level of gallbladder 31. So the first needle will be at the level of this here. Then the second needle to tune up and third needle to tune down. So it is called 88.17, 18, and 19 3-point unit. It is called leg rapid horses. I will show you few more because I want to make sure that you have understood very properly with a very important point. We can't ignore these points, right? Wait for a while. So let's see one image, then I will show you one video. First, look at that. So look at this image from the knee, the upper border of the knee. We are going 7 tune up. That is the first point, 88.17. Then we are going 2 tune up. That is 88.18. Then we are coming 2 tune down. That is 88.19. 3 points. And these 3 points are called, so, or in the easy way we can tell there are 3 points. The first point is 5 tune up. Second is 7 tune up. Third, 9 tune up. The 3 points together are called leg rapid horses. The indication is skin and lungs, so it's very good for asthma. Now let's see the video. 5 tune, 7 tune, and 9 tune up. So this is the video number 1. Leg rapid horses, 88.171819. So this is the ASIS, anterior superior iliac spine, the protruded part. So from this part, from ASIS, the protrusion, I am touching this protrusion, and if I am drawing the line from here till the outer corner of the knee, this is the stomach meridian. This is the stomach meridian, right? So from the protruded part till the lateral corner of the knee, if we are drawing the line, this is the stomach meridian. Our leg rapid horse is located on this line. Or I told you, measure the point with the help of middle finger, that is gallbladder 31. Now from this, it becomes 3 tune anterior. From this point, if we are coming 3 tune anterior, then also we are reaching on the stomach meridian. So there are 2 ways, and this is the middle point. So in this way, we search the stomach meridian, we search the central point. The central point is 7 tune up from the lateral corner of the patella. Now we are marking the central point. Then the 2 more points we will mark. The central point is called 88.17. Then the point 2 tune up, 88.18, and 2 tune down, 88.19. They are the 3-point unit called leg rapid horses. Look at here in this image. We can see the stomach 32 points in between. So these leg rapid horses very good for lungs and skin problem, right? So we can use in the pleurisy, rhinitis, the infection of the ear, even the tuberculosis, and there are many conditions. Like we can see how to needle these 3 points. We can insert 1 chun, half chun, or 1.5 chun needle. Now, in needling, there is one very specific thing. I will tell you what. Before that, I would like to show you one another video just for revision purpose. Then I will be comfortable that you know now. One. Again, the same video, but maybe in a different way. So we are drawing the 3 point. We are putting the point bilateral for the patient. The first point in the center, which is 7 chun up from the lateral corner of the knee, right? Then 2 more points, 2 chun up and 2 chun down. So it is a very simple way to serve the 3 points. Whenever anyone suffering with a skin problem, just put the 3 point in the right leg, 3 point in the left leg, over, done. If you don't do anything, even your patient is going to get the results in the skin problem. Okay, so done, both the points, the same thing. Okay, now remember the special needling technique. There is a number 1. There is a no special sequence. Number 2. Tell me, if you want to treat the skin, are you treating the energy of the superficial part, middle part, or the deeper part? Definitely superficial part. Yes or not? Skin found in the superficial or not? Like if we do the comparison, skin and muscle, skin is superficial. Skin and fat, skin is superficial. Skin and internal organ, skin is superficial or not? We want to treat. Suppose if you want to treat the heart, definitely you are treating something very deeper. Kidney deeper. But skin superficial. The meaning of skin is sky. Sky means like the sky is covering whole earth. In the same way, skin is covering the humans. This is the covering of the human body. So we can tell this is the space, this is sky. This is the limit. Like sky is the limit. This is the limit. So as per the master too, very wonderful concept. Please remember this. Do not forget these lines. If you want to treat the skin, treat the skin. If you want to treat the nerve, put the point near the nerve. If you want to treat the muscle, put the point in the deeper muscle, like this is the deeper muscle. Buttock is the deeper muscle, buttock, or the thigh is the deeper muscle. Muscle, like if you want to treat the heart. Heart is, what is the heart? Heart is muscle. Muscle. So put the needle where you are having very bigger muscle, like thigh, like this part, very bigger muscle. In the finger, we don't have that much big muscle, right? As per the master concept, if you want to treat the skin, put the needle in the skin. How to put the needle in the skin? So first we have to put the needle, maybe 1 chun, 1.5 chun or 2 chun. Leave it there for 10 minutes. After 10 minutes, bring the needle little up at the middle level. Then again after 10 minutes, bring the needle at the superficial level. So we can divide the level in 3 parts, heaven, or we can divide the needle in 3 parts, upper level, middle level, and the deeper level. First needle the deeper level, But our target is not the deeper level. Our target is superficial. Then bring the chi from the deeper to the central. Then again bring the chi from the central to the superficial level. Let the needle be there for longer time. So 10 minutes, 10 minutes, 10 minutes you can do. Or 7 minutes, 7 minutes, 7 minutes you can do. 20 minutes, 20 minutes, 20 minutes you can do. Start with the deepest needling, then the middle needling, then the superficial needling. If your target is skin, right? Skin, because you want to treat the skin. Is it clear? You will achieve wonderful results, because at the last your needle is resting. Then you will remove the needle. Then our energy will reside at the superficial level. Energy will be doing healing at the superficial level. So this is a very wonderful method. Got it? So remember this, right? Okay. So this was the description. When the person is having ear discharge, the pus is coming from the ear. Pus discharge. Excellent point. Why the pus is coming out from the ear? There are two reasons. The reason number one, the skin infection in the middle ear. The reason number two, the kapha. There is too much kapha. Then with the help of throat, with the help of pipeline, it is coming in the ear. We know there is a connection of the throat with the ear. You know or not? If we are suffering with a cough, even it might affect our ear. We might listen little. Hearing is getting difficulty. So ear is having connection with the lungs. Kapha will do the impairment in the hearing. Then sometimes what's happening? So person is having kapha, lung problem, then ultimately suffering with the ear infections. So leg rapid horses are the points who are treating the lungs as well as the skin. So wonderful point for the otitis media and the pus discharge from the ear and the tinnitus or the ringing sound of the ear. Clear? Clear? Not difficult? Easy? So in this way, I am standing here. So this is I will find out there's a protruded part here. Oh, I got it. I can find this is protruded part. Bony part. From this, I will make the line. From this part, I will make the line till the outer corner of the knee, that is the stomach meridian. Got it? How to draw? That protruded part, which I'm feeling here, that protruded part, I'm feeling it. That is called ASIS, anterior superior iliac spine. So we can feel the protruded part. How many person can feel it in the reality? Anyone can feel it? Just from here, draw the line till the lateral corner of knee, that is stomach meridian. And if you don't know what to do, just put the 3-4 needle randomly in this meridian. That's also enough. But do not forget to bring the needle at the superficial level. Okay, for few minutes when you finish the treatment. It is mandatory. Otherwise, your treatment might go at the deeper level. Maybe your treatment will go just for the lungs. It might not will be coming to the skin, right? But we have to treat the lungs, we have to treat skin, both condition. Okay, got it. So let's proceed ahead. Now, now I am going to discuss two very wonderful points. They have been proven excellent point for COVID-19 for in the palm, in the 22-point unit. They're the wonderful point for COVID-19, for cough, for pneumonia, for all the lung disorders, and they are really very wonderful points. Excellent point. If anyone is having any type of cough problem, just 2 points enough, enough and enough. Only 2 points. They are called 22.01 and 22.02. Let's see here. So now I will be discussing with you only 2 points. 22.01, the name of this point is double child. So this is the point here. I will tell you how to locate on the palmar side, on the Hateli side. Look at here. This is the point 22.01 and the next point is 22.02. These 2 points together are one of the great points for pneumonia, for the common cold, for the coughing, for the asthma, and more effective in the children. As per the master Tung, this point is more effective when we are kid. As we are becoming adult, the effectiveness of this point is decreasing, right? With the time, with the age, the effectiveness of this point is decreasing. But in the childhood, this is the more effective point. But even after that, for the COVID-19, this is the wonderful point. Okay, so I would like to demonstrate you 22.01 first. Then with this point, I will also demonstrate you 22.02 because both the points just next to each other. So look at here. So look at my hand. You can see this mountain. This is the thinner muscle or the mountain. In the Hastareka Vigyan, we are telling it Sukra Parvat. Do you know that Sukra Parvat? On the Sukra Parvat, when the Sukra Parvat or the mountain is ends, we can see the margin where it ends. So let me draw the line at the margin, but make sure when you're drawing the line at the margin, this will be exactly when this thumb is ending here. So when the thumb is ending here, from there only, if I draw one line here, I'm talking about this line. I'm talking about this line. So at the level of the border of the inner border of the thumb, I can feel the border of this mountain. Even I can pull the muscle and I can feel the border of muscle, right? In this line, from this point, from the root of the thumb, I have to draw 1 point, 1 chuna away. Then another point, again 1 chun away. There are 2 points. 1 chun, then the 1 chun. 2 points. So these are called 22.01 and this is called 22.02. The 22.01 and 2, these 2 points are one of the great points for asthma, pneumonia, and all the problem of the child, the fever of the child. I will tell you, when the person is getting sciatica pain, as per the TCM, all sciatica is not same. So suppose one day, because there are lots of acupuncture colleges under construction, and you will become teacher, and someone will ask you, I'm having sciatica pain. Tell me protocol. Then you know what is the question? Okay, tell me which type of sciatica? Lung sciatica, heart sciatica, kidney sciatica. What is the meaning of this? The meaning of this is sciatica pain might be because of lung deficiency, heart deficiency, kidney deficiency. Sciatica pain might be because of the hypofunctioning of the lung, hypofunctioning of the heart, hypofunctioning of the kidney. The treatment will be different. Or sciatica pain might be because of the collection of humidity. So treatment will be different, right? If the hypofunctioning of the lung, these 2 points are wonderful. One lady came for the treatment of severe sciatica pain. But we got immediate diagnosis because she was also having asthma. She was also having asthma. But again, asthma also having 2 pattern, lung pattern, kidney pattern. Okay. Because when we are breathing by the lung or kidney. Tell me, whether you breathe by lung or kidney. Breathe in. We breathe in by kidney. We breathe out by lung. Kidney, lung. Kidney, lung. Kidney weak, asthma. Lung weak, asthma. It's very difficult if you don't know the proper diagnosis. So one lady came to me. She was having asthma, cough and cold, and sciatica. She was having long standing sadness. So sadness also the pattern of lung. We found that she is having lung pattern. Then as soon as we praised this point, 22.02, pain reduced, and we leave the point, pain came back, press, pain gone, like switch. We are pressing, second number point, pain disappeared. Then again, release, the pain is coming back. So we put the 2 needle here. As soon as we put the 2 needle here, we found a wonderful effect, excellent effect. And just within the few days, she got excellent results. We treated the sciatica, but she got free treatment of lungs. Okay, free treatment. Even we just charged for sciatica pain, but we treated lung for free without taking any charge. She got wonderful effect in asthma. She was carrying inhaler all the time in the bag, but she was asking me after 2 years, doctor, still I should carry the inhaler in my bag. Then I told it's depend on your confidence level. So guys, if I am having my pump in my bag, I feel comfortable. If I get the attack, then, but since 2 years, he never took the inhaler. Never. Because we did the proper diagnosis and we did the treatment on the 22.01 and 22.02. In spite, these points are little painful, but I will do the demonstration. I will don't show my face, otherwise you will see the pain. So I will hide my face. Okay. So look at here, the first point. Okay. Very. I'm inserting only little needle. Wonderful. When I put the needle, I feel very pleasant. Wow. It's a beautiful pain. Little pain will be there because palmar region having too many sensory nerves. It is a very sensitive area. Okay, that's why we can touch someone. Okay, we can touch someone, and this touching is really very, very powerful, right? If we touch someone from the palm is having highest sensory nerves. In the backside, we are having high motor nerves. So the point number 1, 22.01. You can see it. It's visible. Then the next point, 22.02. So we'll put the needle on the 22.02 now. Here on the second. I'm taking the support of cube For patient, you can take the support of Q and even you can put without the Q. So this is the second point. 22.02. Now just imagine if my needle is on the second point, 22.02. If I insert too much R par, where it will go? It will come here. See, my needle is here. If my needle is going R par, it will come here on the union of two bones. That is called lingu. One of the great point for lower back pain. So this is the yin lingu, this is the yang lingu. Got it? And remember one thing. The lingu point means at the union of these two bones. This is the one bone, this is the one bone, and this is the union. If you put the needle here, lower back pain will go away immediately. This point is very effective point. In the master of acupuncture, I'm sure 50% participant will be knowing this point. How many percent already know this lingo? You know, yeah, many percent are knowing. Lingo, one of the great points. So either you'll put the lingo from here or lingo from here. If you are putting the lingo point from the inner side, it will also work immediately. If you are not confident in needling, you put chana seed. चने का दाना लगाएं. चने का दाना लगाएंगे तो भी फायदा मिलेगा. I have done this thing. I have put the seed to the patient and told, okay, keep on pressing. He got very good results. So right now, because lingo is the very detailed subject. So right now I'm discussing 22.02. This point, one of the great point. So the 22.01 is called double child. And this point is called double scent. इसको संत महाराज कहते हैं, संत महाराज. इसका कारण नहीं पता कि इन्होंने क्यों कहा. पहले दूसरे वाले को संत की संज्ञा क्यों दी, इसका कारण बिल्कुल नहीं पता. But the points is really wonderful. 22.02 double scent. सेंट की स्पेलिंग क्या होती है? SAINT. Master Tung has told double scent. Lingu davai will come. Lingu davai will come. Is lingu davai in the root? Don't worry for the confusion. We have not discussed lingu davai. We just started the journey from 22.01 and 2. The lingu davai will come after a few points. Right now, I would like to tell you, as soon as you are inserting the needle on these 2 points, they will work on the lungs. They will remove the cough and cold pneumonia. They will remove the COVID-19, flu, influenza, all type of the cough and cold. Any problem because of the lung, they will improve. Can you tell me what are the problems happening because of the lungs? Number 1, sciatica. Number 2, shoulder pain. Shoulder pain is because of the high also lung. This is the shoulder area because of lung. In the advanced TCM we discussed, neck is connected with the liver, shoulder is connected with the lung, right? Remember? If you don't know, so please remember this time, shoulder is having very deeper connection with the lungs. So when the person is having lung problem, might get sciatica. That's why the person suffering with the asthma, after many years, they will be suffering with the lower back pain or sciatica. And also the shoulder pain. Shoulder pain is because of the, so the 22.01 and 22.02, one of the great point for shoulder as well as the neck pain. We can treat these 2 points. Two points are very sensitive due to its location in the palmar side. Look at here now, once again. So 22.01 double child. So we are taking 22.012 for pneumonia. But another point, which I will discuss shortly, it is a very good point for common cold, coughing, asthma, and very, very effective in children. Then there's another indication. It's a very good point for the neck pain, also for the knee pain, because if the lungs are in disharmony, they will also create the medial knee pain. So we have used the 22.01 and the 2 points many times for the knee pain. We are using these points for the patient of stroke. When the patient is having the attack of paralysis, not able to lift the shoulder, the half body paralysis, we are using both the points 22.01 and 2 on the opposite side for this patient, on the healthy side for the patient. So shoulder and the upper back pain, we can use these points, right? These are the indications. Okay, ये हमारे कुछ indication है इसके. In the same way, if we are coming to the 22.02, or it is called double scent. The second point, it is also very good for the back pain and the sciatica pain, and this is the most beautiful point for the back pain and the sciatica pain. And you can see the location of this point at the union of bone. If you are inserting the needle and it's going to the opposite side, meeting with the lingu. Lingu is another point which is very good for sciatica. So we are inserting the needle on the palmar side. It's a meeting in the deeper muscle, and there is also lingu. So we are using for all the lung problem, again for the knee problem. So 22.01 and 22.02 are the very good points for lungs. Also, we are using for the knee. Also, we are using them for heart and the palpitation, right? So these are the few common things. As per the diagnosis, many times, if there is a problem in the lung, ovary also develop the cyst. There is infection, inflammation in the ovary. So 22.01 and 2 also very good point for ovary, right? So few things need to remember. The number one. These points are very good for lungs, very good for knee, again very good for lungs and heart, very good for knee, and very good for hemiplegia or stroke on the upper side. Put the 2 point here. If you are putting the 2 point here, they will be improving the chi on the other side. They are improving the lung chi on the other side, right? So in this way, these points are very good points, and we can always use these points in a combination for the patient suffering with stroke or hemiplegia. Suppose some patient is having stiffness in the hand. We can use the 22.012 on the other hand. If the person is having stroke and the stiffness in the hands and even in the arm, we can use 22.012 on the other hand. So finally, if you ask me, tell me only 2 things, I will tell you. Number 1, these points are very good for lung. Number 2, for sciatica. And number 3, I can add shoulder pain. 3 points. Lower back pains or sciatica, lung disorders, shoulder pain. So we can use these points for 3 conditions mainly. right? Yeah, these points are very good point for cough and cold and the asthma. Okay, so let's go ahead. One of my friend, I've seen he is doing the sujo. In the sujo, if you see the person is having shoulder pain, the sujo practitioners are doing the treatment here, right? This is the, because head, neck, this is a shoulder area, and that is also the shoulder area. So doing the treatment here. So one of my friend who is doing just sujo correspondence, nothing else, no 6 key, no trials, and he doesn't know anything. He just do the sujo correspondence, and for the shoulder pain, he used 22.02 point, and really it's work very nicely. Even when I saw him that he using this point for the sujok, then I asked, did you learn master to acupuncture? He told, no, I don't know that. But in the sujok, this is the point for shoulder pain, right? So indirectly, many person in the many different thought process, they are using this point, but this point is wonderful. And he is putting chana, only chana, nothing else. No needle, no other magnet, just a chana seeds. And as per him, chana seeds is most wonderful for shoulder. So you can also try it. One, I was traveling, one lady was having too much pain. I was traveling in the bus many years back. One lady was having too much back pain, sciatica pain. I can see by the face that she's having too much trouble. Then I told I do acupressure. Can I help you? So then I put the chanas. Then I tried to put the chana seeds, but I was not having paper tap. Then I just told the family member, please praise this point. Okay. So just they prayed for 3 minutes, then pain disappeared. Okay, they smile. Then during the whole journey, whenever they were feeling little bit discomfort, they keep on pressing that point. The journey of 6 to 8 hours completed very nicely. Okay, then I told them put the chana seeds on this point, and after that, within the few days, just by the single point, got wonderful results. Even the single point can heal the problem wonderfully in the master tone. Okay, so let's proceed ahead and see the next point. Now, after 22.01 and 02, I would like to discuss a very good point with you. That is 22.03. 22.03. Look at here. So there are 3 points. They are called three whites. Or we are telling upper white, middle white, and lower white. So upper white is here, but the middle and lower white is here. We will be discussing the middle and lower white later on. The upper white is working in the upper body, the middle white working in the middle body, the lower white working in the lower body. So upper white is here, upper white working mainly for the eyes and the neck. If you ask me the indication, only a single indication, I will tell you upper white working for the eyes and the neck. Okay, so Master Tung has used too many imagination. Only the single person in the world who has used multiple microsystem in a single therapy. Look at here. So as per the Master Tung, so this is the one hand, this is another hand. Okay, there are 2 hands, right? Okay, maybe you are thinking it's a leg, but it's a hand, right? Nails. And master, as per the Master Tung, we are looking the whole hand together. So this is the entire head region. head region. So we are having eyes here, and we are having ear here, and mouth is here, nose is here. Okay. So when you are coming in the central part of here, that is 22.03. This is one of the great point for eye, excellent point for eye. So we are using a lot this point for the conjunctivitis, for the red eyes, for all the infection of the eyes. So if you see the indication of these points, look at here. So here, these are the eyes. So this is a very good point for red eyes, for eye itching, for conjunctivitis, for multiple problems of the eyes. And if you combine this with the upper three yellow, because we know upper three yellow are the 3 points for the liver, then they become very wonderful points. So look at here, we can use these points very nicely when there is a pandemic attack of the conjunctivitis, because this point is working for sudden and acute problem. So look at my hand here. We can feel the knuckle here. So if you see between the knuckle, you can see the soft part. Okay. So we can see this is the distal to the knuckle, and this is the proximal to the knuckle. So we have to put one needle proximal to the knuckle. So this is a very good point for two problems. Number one, neck pain, and number two, eye problem. Two problem can be cured very nicely with the help of this point, right? So even I have put one video on the Facebook many days back. Even it's still available right now on the Facebook. One principal came with a stiff neck. She was not having any eye problem. She was just having a stiff neck problem. I asked her how it's happened. She told me yesterday night she got this problem. So she was having a stiff neck. I just inserted this point and she got immediate relief. Even I put one more point here. Give me 1 minute. Yeah, see, this video I have put in the, see, look at the happiness of the patient. See, the 2 point I put on the face and 1 point in the hand. 22 point. Look at this. Many years back. She's not telling anything.
Large the problem is, but they are going to treat within days, and I'm very happy about that. Yesterday, actually, I am with a very severe neck pain, and I'm not even able to move my neck or head a little bit also. But today, I'm able to rotate it a very nice way. I'm very happy about it.
Now see, she's Srilata. She's principal. She's my patient since 2-3 years. Have you seen full video? Because see, you just can see the face. But I first needle I inserted 22.03 for neck, stiff neck. Then second needle I inserted here that I will discuss later on. That is the very good point for lung and kidney both, right? That on the face, I will only 2 point I inserted. When the person is having neck pain, we have to put 22.03 on the opposite side, this point. So when the person is suffering with the neck pain or the eye problem, see the knuckle, and the proximal to the knuckle, we can feel the depression here, and we have to put the point here. And many times, as soon as you put the point, you will see the immediate results. Look at here in this way. Again, there is no direction. How many person can understand? Very effective point. Wonderful point. The purpose to show the video, how the patient is happy that in the one sitting I got relief. Just by 2.1, 22.03. And another point is on the face, which I will discuss later on. So this point is one of the great points which we are using for eye and the neck problem. Yeah, so someone tried, neck pain reduced. Wonderful, excellent. Chayaji tried, excellent, wonderful. So we got immediate feedback. That's very good. So look at here now. We'll discuss a little more about this point, 22.03. So 22.03, just I demonstrated. This is the point here. 22.03, upper white, middle and lower white will discuss shortly. It is a very good point for neck pain. In the neck pain, we can put the needle bilateral. There is no problem if we put the needle bilateral in the neck pain. But neck pain only in the one side, we can put the needle on the opposite side. Even we can choose this point for the shoulder pain. And even we can choose the lateral side of heart pain. Lateral side of heart pain. Someone is having the pain of the heart in the lateral side. So 22.03 point is also very good for the sciatica, and the main indication is conjunctivitis, red eyes. We can combine it with the upper three yellows because upper three yellows working on the liver, so they are very beautiful points for the eyes. And if we do the ear apex bleeding will remove all the inflammation, In the master tongue acupuncture, also ear apex bleeding has mentioned. I will do the demonstration. With the 22.03, if we do the bleeding on the apex, it will remove red eyes immediately and it will remove neck pain immediately. Just do the bleeding. There is a one condition in the bleeding we always do on the same side. So we are using 22.03 for the problem of eyes. We can combine with the 88.121314. Even we can combine with the 11.17. 11.17 is the point for liver chi stagnation. 11.17 are the point of liver chi stagnation. And if you remember, we have inserted these points in the index finger in the D line here. These are the points on the D line, A, B, C, and D. 11.17. 11.17 are the very good point for eyes, tearing eyes, dry eyes, liver chi stagnation, all the problem of the eyes. So if we combine the 22.03 with the 11.17, it becomes very good protocol for eye itching. Sometimes eye itching also give a very big discomfort. So in this way, this is the indication of 22.03 point. Liver stagnation and the liver chi stagnation is the same condition, right? Both are same. Whether we talk liver stagnation or liver chi stagnation, both are the same condition. Got it? Okay. Wow. So today we discussed 22.01 and 2. One person, it was really good. I have seen someone has conducted one day workshop in Mumbai or somewhere on the COVID. And really, I have seen the main theme of that workshop, COVID-19, master doing acupuncture for the COVID-19, and 22.01 and 2 was the point. Okay, only 22.01 and 2 was the point. So even many other person, one MBBS doctor, he made me and told me, doctor, I used 22.01 and 2 for many patients suffering with COVID and they are doing great, right? So these 2 points are really very good for the lungs, and we can also use for the sciatica. We can also use for the shoulder pain, paralysis, and 22.03 we can use for the eyes, right? So enough for today. Now tomorrow we will discuss 22.045. They are the one of the great point in the palm, or I will tell you the wonderful point in the master doing acupuncture. 22.04 and 5 we'll discuss tomorrow. So today we have discussed only 3 points. So just remember the 3 point and we'll meet tomorrow. Okay. Any question? Yes. Yeah, please.
So for tuberculosis, only 88.18, 17, 19 are enough, or anything more we have to add?
See, if we talk about the 88.17, 1819, these points are very good for lungs, whether the pleurisy, whether the tuberculosis, whether any problem. But if we talk about the tuberculosis, in the tuberculosis, these 3 points will be helping point. Okay, these 3 points will treat the tuberculosis condition 70%. But tuberculosis is the very infectious condition. We have to expel, we have to add a few more points. Generally, only the tuberculosis patient is not coming to us. They will come to us only if they are untreated. They means many persons, they are taking the allopathic medication.
Yeah.
But sometime allopathy not responding.
Low.
Then they will come to us.
So any other points we can add in this? If suppose we want to add,
We can add lower 3 emperor, because lower 3 emperor will expel the humidity. We can add other than these 3 points, because we have to work on the lungs. We have to remove the phlegm, because in the tuberculosis patient, whatever he's eating, it converting in the phlegm, right? So just you add lower 3 emperor.
okay.
With
So,
these 3 points. So we are removing the phlegm and we are increasing the capacity of the lung, and stomach is already covered because all the 3 points are in the stomach meridian itself, right?
So all 11 points completed.
How?
We have no,
No,
not
11 is complete.
So how many points are there? 27 or 32?
27.
Google is showing 32.
Maybe some person has added some point, but in the master literature only 27.
Okay, sir. Thank you.
Maybe like Dr. Bol is keep on adding some point. Maybe not by the master room, but some of the student of the master room has added. Okay. If you have some literature or something, you can send me. Okay. I will cross verify. Okay. Because I have international book of the master room, which I purchased from foreign abroad. In that there are only 27 points. Right.
Yesterday I read. Okay, I'll show you.
Yes, Chandrakanta ji.
Sir, on point number 22.01 and 22.02, Suzok needles are sufficient, or we have to go with a large one?
A small needle is also, small means Sujok needle?
Yeah.
Yeah, sometimes
Yeah.
Sujok needle. Yeah.
I
So
am getting good results with Suzok needles, but it's always element of doubt in my mind ki maybe.
see, I will tell you, thicker the needle, if you are using little thicker needle, not too much, then it will do more damage of the area. So more damage of the area will create more results. But if the person is very sensitive and might not allow bigger needle, so you can choose, you can keep the both type of needle in your clinic. For the high sensitive patient, you can use Sujok needle. For less sensitive patient, you can use bigger needle, Vanchun needle. Results can be created by both, but definitely little better results will be created by the bigger needle. Okay. Because Sujok needle is very, very thin. In the acupuncture, it clearly mentioned that very thin needle we should use on the face. Then little thicker needle we will use on the scalp. Then more thicker we should use on the body, right? Like we talk about the gauge. On the body, we should use the needle of 30-32 gauge. In the India, we are using 25 gauge. Okay. 25 gauge also good. But on the face and the scalp, we should use little thin needle. Sujok needle is very, very thin. Very thin. Okay, but even I have inserted to many patients and we always get the results. So we are happy. But if you are sometimes you are not getting, then choose the bigger one, right? Yes, Simaji.
Namaste, sir.
Namaste.
सर 22.01 एंड 02 क्या हम लोग जैसे कि लंग्स की डेफिशिएंसी होता है ना, बच्चों में क्या होता है कि विंड अटैक जल्दी हो जाता है, कोल्ड चाहे तो विंटर में कोल्ड का अटैक होता है और गर्मी में गर्मी का अटैक होता है, तो क्या हम लोग लंग को स्ट्रेंथन करने के लिए हम लोग वहां पर लगा सकते हैं ये वाला
Yes.
बच्चों में?
It's It's a
Right?
very effective point for lungs.
तो ऐसा लंग्स की डेफिशिएंसी में हम लोग ये यूज कर सकते हैं?
Yes.
ओके,
Because these are
Thank
the special point for hypofunctioning of the lung. But as per my experience, I found this working for all the condition of lung, whether the
Okay.
hypo or the hyper. Okay.
ओके,
You can
तो
only
ओनली
use for improving the immunity of kids. Right?
ओके, थैंक यू सर.
Welcome. Yes, Preeti ji.
हाँ सर, इसमें जो लंग्स के जो सब पॉइंट्स आपने बताए, तो क्या वो सैडनेस में भी यूज कर सकता है कि लंग्स और सैडनेस इंटरकनेक्टेड है? तो
Sadness में
हाँ, सैडनेस में कौन
कर
सा वाला
सकते हैं,
रहेगा सर? कौन सा वाला?
लेकिन कर सकते हैं, लेकिन जैसे जैसे उम्र बढ़ेगी ये पॉइंट की इफेक्टिवनेस थोड़ी कम हो जाती है.
तो और कोई पॉइंट होगा लंग्स का कि जो इसमें ज्यादा काम आए सैडनेस में, कोई बताओ कि सर?
लंग में आप सैडनेस में
जी
सैडनेस में आप लोअर अभी 88.17 1819 यूज कर लो. सैडनेस में हमें लंग को ही तो ठीक करना है.
अच्छा, 1789.
हाँ,
अच्छा, ओके
अभी
सर.
आज हमने जो समझे
जी
अल्टीमेटली व्हाट इज सैडनेस. देखो एज पर द एक्यूपंक्चर, emotion, what is emotion? Emotion are energy, right? You are joyful means high energy. Anger means high energy. Sad, low energy. Depressed, low energy. Feeling fear, low energy. So you have to change the energy. So the person cannot be sad if having high energy, right? So if the person is sad, improve the lung energy, because lung is the place of corporeal soul, and when lung is not right, corporeal soul is making you sad. 88.171819 is a very good point. Okay, Jalvinder ji.
सर नमस्कार सर.
जी नमस्कार. Jaivinder ji, sorry Jaivinder.
जी, जी. सर मैं ये पूछना चाहता हूँ 22.03 ये ग्लूकोमा भी काम आएगा?
देखिए ग्लोकोमा में इसका इतना रोल नहीं है, ग्लोकोमा में ज्यादा रोल है 88.12, 13, 14 का, है ना। ग्लोकोमा में आपको क्या करना है कि आप एक तरफ लगा दो 88.12, 13, 14, राइट, इन द लेफ्ट लेग, और
जी।
राइट में लगा दो लिवर 236,
लिवर 236।
लिवर 236, क्योंकि ग्लोकोमा में आपको आंखों का प्रेशर कम करना है। लिवर
या
236 लगा दीजिए राइट में, और लेफ्ट में लगा दीजिए 88.12, 13, 14 यानी अपर 3 येलो। और
यस सर।
ये हमारे मेन पॉइंट हो गए। अब इसके अलावा लगेंगे थोड़ा सा आपको सिस्टम को काम डाउन करना पड़ेगा 80 हमारे लोअर 3 एम्परर के द्वारा, लोअर 3 एम्परर के द्वारा 88 जो
जी।
77.17 वो सब समझेंगे, लेकिन मैंने फिर भी बताया है लोअर 3 एम्परर का मतलब है स्प्लीन 6, स्प्लीन 9 और एक पॉइंट इनके बीच में। इतना अभी आप इतना करिए, बाकी हम बाकी मैंने जब लिवर का डिस्कशन किया था तभी ग्लोकोमा का प्रोटोकॉल भी लिखाया था, फिर भी हम आगे भी बात करेंगे क्योंकि अभी सब बाकी है, लेकिन इतना आप करिए, इससे भी काफी बेहतरीन रिजल्ट मिलेगा।
सर
Liver 2 and liver 3, one of the great point to calm down the BP, whether it's the body BP or the BP of eyes.
ओके सर।
ओके, और आपको और भी कुछ करना है एक्स्ट्रा तो ईयर अपेक्स को ब्लीड करिए। आप ये जो हमने समझा 22.03 को ऐड कर सकते हैं एज ए हेल्पिंग पॉइंट, लेकिन
सर केस
बिना अपर 3 येलोज के ट्रीटमेंट अधूरा होगा।
जी सर K7 को भी तो ऐड
हाँ,
कर सकते
K7 आपका गॉलब्लैडर 37 वो हमने सब बताया है उस समय डिस्कशन में, है ना।
जी जी जी
किडनी 7 इज द वेरी गुड पॉइंट, गॉलब्लैडर
जी
37 is a very good point, gallbladder 37 is a very good point for each and every part of the eyes, and kidney 7 is a very good point as per the master Tung। इसको हम समझेंगे, मास्टर टुंग ने इसको एक अलग नंबर दिया है, वो हम बात करेंगे, है ना।
जी सर। जी जी जी।
ओके माया जी,
थैंक यू सर, थैंक यू वेरी मच।
नमस्ते सर।
जी नमस्ते माया जी।
सर ये जो आपने स्किन के लिए बताया छोटे मोटे पिंपल्स वगैरह के लिए है या ज्यादा स्किन की प्रॉब्लम
नहीं
सबके
छोटे
लिए?
मोटे पिंपल्स पर भी काम करेगा,
अच्छा अच्छा, और
चाहे
अस्थमा के
छोटी
लिए
मोटी
भी
प्रॉब्लम हो चाहे बड़ी प्रॉब्लम हो, दोनों पर ही काम करेगा।
दोनों पर काम करेगा?
हाँ जी, यस।
अच्छा, और वो डेली लगाना है या गैप के साथ लगाना है?
डेली कभी नहीं लगाना, वीक में 3 बार लगाना है।
ओके, और धीरे धीरे कम करते जाना है?
डेली लगाएंगे तो क्या होगा कि हमने जो एक पेशेंट को डेली लगाया तो इससे 2 नुकसान होते हैं। पहली बात तो 3-4 सिटिंग 5 सिटिंग आप डेली दे, लेकिन फिर डेली देना है तो फिर आपको स्किलफुल देना पड़ेगा, आपको अलग अलग एनर्जीज पर काम करना पड़ेगा। अगर आपने एक ही पॉइंट डेली डेली लगाया तो इफेक्टिवनेस कम हो जाएगी, एनर्जी हो सकता है एक्सेसिव हो जाए और फिर उसके कारण कुछ दूसरी प्रॉब्लम हो जाए, ऐसा हो सकता है।
अच्छा, ये हम अस्थमा पे सेम चीज सेम पॉइंट्स यूज कर रहे हैं तब तो हम डीपर लेवल पे करेंगे, और
अस्थमा में
स्किन
आप
के लिए करेंगे
88.17, भी ले लो और 22.012 भी ले लो।
अच्छा, और जब स्किन पे सेम यूज करेंगे तो हम फिर लेवल्स को 3 लेवल पे करेंगे जो आपने आज सीखा।
हाँ जी, हाँ जी।
और लंग्स के लिए वो करने की जरूरत है?
730 लंग्स के लिए आप
बस
निडल
deep।
को डीप लगा के छोड़ो।
ठीक है, ठीक है, थैंक यू सर।
जी
ओके जी, थैंक यू।
जी बताइए मंदाकिनी जी।
हेलो सर।
जी मंदाकिनी जी।
सर आपने शोल्डर पेन के लिए अभी बताया 22.02 भी हम नहीं 22.01, 02 दोनों यूज कर सकते हैं। लास्ट एक क्लास में पहले आपने बताया था 10.19 भी शोल्डर पेन पे सेम साइड अगर आप करेंगे 10.19 तो वो भी शोल्डर पेन रिड्यूस करेगा।
हाँ हाँ
सर हम
आप एक्चुअली, हाँ आपने सही बोला। एक्चुअली आज मैंने आपको जो एक वीडियो दिखाया ना,
जी सर,
उसमें आपने देखा यहाँ पर एक पॉइंट लगा
हाँ
हुआ
जी, हाँ जी,
वो वही था
10.19।
हाँ, आपको फिर से वीडियो देखना है।
नहीं सर वो तो मुझे पता है 10.19 आपने यहाँ
वही
लगाया
था वो, यानी दोनों काम करते हैं, तो मैंने उनको वही लगाया। मैंने क्या किया, उन्होंने कहा शोल्डर पेन है तो मैंने सेम साइड में 10.19 लगा दिया यहाँ पर, क्योंकि आपको ध्यान होगा मैंने बताया था कि अगर कॉर्नर ऑफ द लिप से
हाँ जी
अगर कॉर्नर ऑफ द लिप से अगर हम जाते हैं
नीचे
0.4 चुन डाउन
जी
तो
और हाफ
फिर उसमें 0.4 चुन अंदर जाते हैं तो 19 and 20 मिलता है।
जी
ये दोनों पॉइंट्स दे आर वेरी गुड पॉइंट फॉर लंग एंड किडनी, राइट।
जी सर।
तो ये बहुत अच्छे पॉइंट है शोल्डर पेन के लिए।
तो हम
इसके
तीनों
साथ
पॉइंट्स
ये लगा दिया और मैंने उनको ये लगा दिया साथ में। ओके, मैं इसलिए
22.03
लगाया क्योंकि वो स्टिफनेस, शोल्डर पेन, नेक पेन में ये भी काम करता है। हम चाहते तो हम, जैसे मैंने कहा, ये भी लगा सकते हैं। ये
जी
डिपेंड करता है कि अगर मुझे लगे उसको क्या था। देखो मैंने क्यों लगाया, मैं आपको बताऊं, मेरी सोच बता रहा हूं। आपकी देखो अपनी अपनी सोच अलग अलग हो सकती है, राइट। अब ये क्यों नहीं लगाया मैंने, यही क्यों लगाया क्वेश्चन। तो मैंने सोचा कि ये आंखों पर भी काम करता है और गर्दन पर भी काम करता है। आंखें मतलब लिवर। और वो लेडी गुस्सा करके आई थी अपने हस्बैंड, है ना, गुस्सा करके रात को गुस्सा किया था उसने अपने हस्बैंड पे, तभी गर्दन अटकी थी। तो मैंने कहा चलो ये लगा दो, क्योंकि आंखों की तकलीफ नहीं है, लेकिन कहीं ना कहीं आंखों पर क्यों काम करता, कुछ ना कुछ लिवर से कनेक्शन तो होगा ना। ये सोच के मैंने लगाया बस, और बाकी कुछ नहीं था। और अगर ये लगाते हो सकता है इससे भी ठीक हो जाता, लेकिन मैंने आपको बताया कि ये पॉइंट कब लगेगा, जब हाइपो फंक्शनिंग ऑफ लंग होगी। उसके तो मुझे कुछ लक्षण ही नहीं दिख रहे इसके, है ना। लेकिन फिर भी मैंने ये पॉइंट लगाया कि कई बार क्या होता है कि लक्षण कुछ दिखते होता कुछ है। ये पॉइंट तो शोल्डर पेन के लिए गजब का है, चाहे कुछ भी हो। ये जो पॉइंट है ना 10.19, ये तो शोल्डर पेन के लिए गजब का। आप किसी भी कारण से शोल्डर का पेन हो, आप लगा दो, तुरंत कम हो जाता है सेम साइड का। लेकिन 22.03 भी लगा सकते हैं और 22.01 और 2 भी लगा सकते हैं, दोनों ही चूज कर सकते हैं एज पर अवर ओन अंडरस्टैंडिंग, राइट। लेकिन जनरली आगे के जो 2 पॉइंट है 1-2 लंग की हाइपोफंक्शनिंग में ज्यादा बेहतर काम करेंगे। और 3 नंबर का पॉइंट आंख, यानी कहीं ना कहीं थोड़ा लिवर से कुछ से संबंध मिल जाए तो ज्यादा बेहतर काम करेगा।
अगर किसी को पोस्ट फ्रैक्चर स्टिफनेस की वजह से पूरी मुट्ठी नहीं बन रही, बेसिकली फर्स्ट थंब का तो फंक्शन अचीव हो गया है, इंडेक्स फिंगर इज आल्सो मूविंग,
पहली बात तो ये
बस
क्वेश्चन
थर्ड
पूछने
वाले
के पहले आपको ध्यान रखना होगा, हमने जो डिस्कस किया उसके बारे में पूछना होगा।
पोस्ट
रैंडम क्वेश्चन अभी नहीं पूछ सकते। 22.01,
वो हैंड का
22.03,
स्टिफनेस है
हाँ
सर, हाथ का स्टिफनेस है।
अगर वो हैंड का स्टिफनेस फ्रैक्चर के कारण है तो भी काम करेगा उस पर।
करेगा।
देखो क्या होता है, मैं आपको एक सिंपल सी बात बताऊं कि 22.01 और 22.02 लंग्स पर काम करेंगे, राइट
जी
और लंग क्या करता है कि लंग हमारी, जैसे कभी किसी को कहीं स्टिफनेस हो जाए उसमें लंग भी काम करता है। जैसे कभी किसी का, अगर किसी के हाथ में स्टिफनेस है किसी भी कारण से, कई बार पैरालिसिस के पेशेंट के हाथों में स्टिफनेस होती है, या स्टिफनेस किसी भी कारण से है, हम अपोजिट साइड में जैसे ही 22.01 लगाते हैं, 22.02 लगाते हैं, हम इधर लगाते हैं और इधर काम होता है उसका, अपोजिट साइड में काम होता है। इधर एकदम पूरे हाथ में ऑक्सीजन पंप हो जाती है, क्योंकि 22.01 और 22.02 का काम है ऑक्सीजन को पंप करना, क्योंकि दोनों लंग के पॉइंट है। ओके, इमीडिएटली ऑक्सीजन पंप हो जाती है, और जैसे ही ऑक्सीजन पंप होती है तो फिर वो हाथ की थोड़ी सी मूवमेंट्स स्टार्ट हो जाती है। यही कारण है कि हम पैरालिसिस के पेशेंट में भी लगाते हैं दोनों पॉइंट्स, राइट। काम करेगा, बहुत अच्छा काम करता है स्टिफनेस में, बहुत बढ़िया काम करता है। चलिए लास्ट क्वेश्चन है ये, लास्ट क्वेश्चन सिंधु जी। यस सिंधु जी।
Sir, you had talked about 3 points, 88.17, 0.18 and 19 for skin disorders. So you said you have to work on 3 levels on key. So should we do it bilateral, working on key?
Yeah. So I also told you that because the skin problem, we cannot consider the skin problem the right side or the left side. Skin problem is a central problem, right?
Yeah.
We cannot, sometimes it might happen the right side, sometimes it might happen the left side, anywhere in the body. So we can use certain points on bilateral, and even almost all the points available on the thigh can be used while alone.
And we can work on the key at 3 levels simultaneously.
Yes, if you want to target the skin,
Yes.
then first needle deeper level, then come to the middle level, then come to the superficial level. But if you don't want to target the skin, just want to target the lung, then deeper is enough.
So this will work for food allergies which cause clean itching?
If you talk about the allergy, allergy is the combination of lung and liver. What is allergy? Allergy is a fight. Right? What is allergy? Allergy means you have eaten something, but your body, your immune system is taking action against, releasing the antibodies. So fight is going on between the allergens and the immune system. So you're getting urticaria, itching,
Yes.
red eruptions. That is fight. In the fight, liver is involved. So we can, in the other word, we can tell liver is attacking over the lung. Okay, what?
Okay.
Why the liver is attacking over the lung? Because lungs are weak. So liver is attacking over the lung. Fight means liver. Liver is the great fighter. Liver is the great general. Okay. So if there is skin problem, no, just a skin problem, very chronic problem like the it might be allergic like the psoriasis. Someone is having eczema because of the allergy of the soap or detergent. But there is acute allergy like the urticaria.
So this is chronic, sir. This is chronic every night.
Chronic, then enough. Chronic, then you can just use leg rapid horses. They're wonderful.
So weekly thrice, sir.
Yeah, weekly thrice.
And we can repeat this for a month. Same point.
No. After the 12th sitting, we have to give the break minimum 7-8 days continuously. Let it the body, because after some time we have to, whenever we are doing the treatment, what we are doing, we are guiding the body energy to the particular direction. Okay. So many times body need energy to some other work, but we are every day guiding. So let the body relax for 7 days. Let the body do on work for 7 days after you do the 12 sittings. Then do start again, right?
Okay. Thank you, sir.
Then you will achieve more results. Even what's happening during the gap, we will get the very good result. You do the 12 treatments and do the gap. Even the gap, the effectiveness will be increasing again and again. Right.
So even though the lungs are weak, sir, you said liver is a great fighter, but the voice is quite loud and that is fine. Still the lungs we say are weak.
See, that is power.
Okay.
Power is different. Fighting is different, right? Okay. So lung means, the lung chi means power. The lung is the governor of chi. Okay, energy. If you are having good lungs, your voice will be louder, but you will be walking slow in the rhythm.
But still that person has asthma now and then.
No. See, don't try to mix here and there, right? We have to move very crystal clear. I'm telling you. See, you asked me the lung. You asked me why the voice is louder.
No, you said that in allergy, the liver and lungs
see,
are
the allergy is the difference. See, you are powerful, right?
Yeah.
You are powerful. You are having powerful voice. Even the people, 500 people listen you without the mic because you have great lung chi. Okay. That is power. But what is allergy? Allergy is a fight between your immune system and the antibody and the antigen. Suppose you are eating brinjal. The brinjal is going in your body. Then suddenly your immune system get alert, oh, something wrong, and sending the antibodies. So there is an antigen antibody reaction, there is a fight. So because of the fight, there is secretion of eosinophil, monocyte, lymphocyte, fighter cells,
histamine, a lot of histamine.
That create allergy.
Yeah.
That is a different thing, right? And louder voice is the different thing. That is the power of lung. You are a strong lung, that is the power. That's a different thing. So if the person is having allergy, immediately how to relieve the allergies? Calm down the liver. Okay. So we are doing bloodletting from the ear apex because that is the point of liver. Yeah. As soon as you do the bloodlet from the ear apex, any type of allergy will be calming down. Any type, whether the urticaria, itching, or eruptions or suddenly happening something, all type of allergy will be calming down as soon as you calm down the liver. So allergy is having connection with the liver, and urticaria, as per the acupuncture, the meaning of urticaria when the liver is accessing, attacking
Okay.
over the lungs.
So, sir, how many times I can do bloodletting? Once a week? Because it's a chronic, it's been over
Yeah,
years.
so I will tell you, like, see, I what I do for my patients. If the patient is having normal condition, I do once a week or sometimes once in 10 days.
Okay.
If the patient is very like severe condition, one patient came to me, told me I have not slept since 3 months.
Yeah, only night times it happens. Yeah.
So itching. I did bloodletting 3 days continuously. Then
Oh.
after that, I do 3 bloodletting alternately. Then after that, I did 3 bloodletting once a week. In that way, I did 9 bloodletting. But for other patient, I do just either once a week or once in 10 days, sometimes once in 15 days.
So 1 year only, right? Both years or 1 year?
Yeah, any, like we can choose 1 year also, or we can, because if we want to bloodlet every day, then we can choose today this year, tomorrow that year.
And the next day I can put these points which I had taught
You're
master.
missing one question. How many drops?
Okay. Yes, sir. How many drops?
How many drops? What
So
do you think?
3 drops?
No, little more.
Oh, okay.
How many?
Around 10 drops, sir?
Little more.
Oh my God.
How many? 50,
15?
60 drops. 50, 60.
15, 16.
5060.
Oh my God.
See, when you prick na, one hole is there, then whether you take a 2 drops or 50 drops, what matter?
Okay.
See, we have to do the blood dating very proper. If the patient is very thin, lean, and very big, then don't take. Then to even in the bloodletting concept, it has been told even the 1 drop of blood is like a 1 pearl. That is also enough, right? But when the patient is good, strong, then take out the blood 30, 40 drops, 50 drops without any problem. Okay.
And next day I can give the master tongue points.
Yeah. And do the mastering point, you will achieve very good results.
Thank you, sir. Thank you so much.
Okay, so now still many questions left, but now you have to put in the chat box.
Okay.
I have some other commitment, so I have to close the meeting now. Thank you so much. See you tomorrow. Have a nice day. Closing the session.